Well, good morning, everybody. Thank you for joining us for our press briefing. We've got a lot of great things to cover today, but as always, we're going to start off with reminding everybody we are still managing this pandemic, so we want people to continue to follow our rules with regard to keeping that 6 foot of distance between yourself and other people when you're in public, wearing a mask when you go to the store, washing your hands often. All those things will help us be able to continue to manage this virus. If you see a crowded bar or restaurant, good opportunity to go to another one. So this virus spreads from one person to another, so avoiding large crowds will be one of the ways to help slow the spread of the virus. So thank you so much, everybody, for all you're doing to be able to remember our social distancing guidelines. And of course, one of the things we always want to remind people is that all the restrictions we put in place, all the reasons we do the social distancing, is to preserve our hospital capacity. And we've done that very successfully here in Nebraska. Right now, our hospital capacity is at 38% of beds available. We've got 34% of our ICU beds available, and 83% of our ventilators are available. So we've still got very robust hospital capacity here in our state. We have through the entire pandemic, and it's in part because of all the great work everybody's done to be able to slow the spread of the virus in our state. So thank you so much. And of course, we also want to remind people about testnebraska.com. Still opportunities to sign up. If you sign up, we have no restrictions on who can get tested, so you can sign up and start looking for a spot to get scheduled. We've got lots of capacity in Omaha and Lincoln, so please look at that testnebraska.com. We have over 333,000 people have taken the assessment, so we've had over 333,000 people get signed up for testnebraska.com. We're very pleased to be able to offer that, so we encourage people to continue to please get signed up for testnebraska.com. If you're going to go see, say, your grandmother and you want to get tested, that's a great example of how you might use testnebraska.com. Also, DHMs. So our directed health measures, you may recall, is what we started to be able to help slow the spread of the virus going back to last March. We are currently in phase 3 in most of the state, though we have 3 public health departments that are in phase 4 right now. Those are Loop Basin, North Central, and Southwest. And now we are going to be moving most of the rest of the state, with the exception of Lancaster County, will be going into phase 4. So phase 4 will begin on Monday, September 14th. And what it basically means is outdoor venues will be able to go to 100% capacity. Indoor venues will be at 75% capacity. If you're going to have a large event, and when I say a large event, 500 people or more, you're still going to have to check with your local public health director, put together a plan, get that plan approved. So that will still all be part of the DHM. But we are, again, loosening restrictions further on September 14th. We still want people to still remember all the guidelines with regard to how all of our other organizations operate, but the big things are loosening up the restrictions on those gatherings. And then I want to talk about personal protective equipment, PPE. The state has purchased over $36,600,000 of personal protective equipment and distributed out through our local public health departments that in turn distribute that PPE out to our first responders, to healthcare workers, long-term care facilities, dentist office, and so forth. And so over the course of the pandemic, we have distributed over 11 million masks, and that includes 2.4 million of the KN95 masks. It includes 5.6 million of the disposable surgical masks and 3.1 million of the cloth masks. Now, it also includes 10.4 million of the sets of gloves, 2.2 million gowns, over 34,000 gallons of hand sanitizer, and over 120,000 containers of those disinfectant wipes. So a significant amount of PPE has been purchased by the state and distributed out across the state. One thing I do want to highlight a little bit, I talked about those KN95 masks. One of the things that we hear from healthcare workers, for example, is they prefer to have the N95 masks. Those are still in very, very short supply. We do have a contract with the state to be able to start getting those, so we expect that supply to start coming into the state here this month. But in the meantime, we are still going to be using the KN95 masks. Now, these are masks that have emergency use from the FDA. They've been tested by the CDC and have been approved for certain vendors of these KN95 masks. Those are the vendors that we, the state, purchase from and then distribute those out. So again, we're still going to be using KN95 masks. until we can see that capacity to be able to purchase N95 masks ramps up. So KN95 masks will be what we're using in the meantime. So that's kind of our update with regard to the pandemic. Now today, we also joined by General Bohack, who is our Adjutant General for the Nebraska National Guard, as well as Brian Tuma, who's the Assistant Director for the Nebraska Emergency Management Agency, Chris Cantrell, who's the State Fire Marshal, and John Erickson. John, where are you? Oh, there he is in the back. John Erickson, who is with the Nebraska Forest Service. And it's really kind of a special day because John has really never been to my press briefings before, and now he's been here 2 weeks in a row. So congratulations, John. Really exciting. Glad to have you here 2 weeks in a row. And we're talking about something that the state of Nebraska has set up really for the first time in our history. It's an emergency management team, or incident management team, rather. And let me take you a step back. Back when we had the wildfires in 2012, there was an after-action report on some of the things the state could do to be able to better manage those fires. So as part of this process that we've gone through, we've looked at various things like getting our single-engine aerial tankers, our seaplanes, looking at how we organize to be able to do a better job in combating these types of incidents. And this is really a process that's been about a decade in the making, crossed these various agencies I just mentioned, the Fire Marshal's Office, NEMA, the Forest Service, to be able to organize this incident management team. Now, what's happened in the past was when there's been fires or other emergencies like the flooding, local responders are the first to respond. And they are the ones that will manage that incident. But if it goes beyond their capacity to be able to manage the incident, they would then ask for the state's help. And what the incident management team will do, again, if the local authorities ask for this, is the incident management team can then step in for the local authorities to take over managing the team, to marshal those state resources and so forth. So this is really, again, a capacity we have not had before in the state that will help us really fill in the gap for those emergencies when managing the emergency is going to be bigger than the local resources can handle. Again, it's all going to be still supporting the local resources. They're the ones that are going to have to ask for us to step in and do this, but now we will have the capability and the capacity to be able to do that. So General Bohack is going to talk about this a little bit. Last week I was actually out in Banner County looking at the Hubbard Gap fire, and again, the folks there did a fantastic job of managing this, but some of the assets that we brought in, for example, the aerial assets to be able to dump fire retardant ahead of the fire, were really critical in preventing that fire from becoming a larger fire. It burned about 4,000 acres, and the folks on the ground there were telling me it could have easily gone to 10,000 acres if it wasn't for those assets. So again, shows how great teamwork can really make sure that we mitigate the effects of some of these damages. I think this year we've already had 15 wildfires. Is that right, Brian? About 15 wildfires already. So it's been a dry year. We've had these 15 wildfires. This is a great opportunity for us to stand up this incident management team to be able to help support managing those types of incidents so that we can do a better job. And General Bohack is actually going to lead us through a little bit more about that and give us some more details. So General, thanks for being here, and talk to us more about the incident management team.
Thank you, Governor. So good morning, everyone. It's a pleasure to be here, and a pleasure to be with the Governor again and to talk about really what is an important moment in Nebraska's history that really began prior to 2012, which was the last large complex set of fires we had in western Nebraska. In that fire complex, we learned that there were some things we could certainly do better, and one of those was interagency work between the Fire Marshal's Office, Nebraska Forest Service, Emergency Management, and National Guard. That has come into fruition. And that has come into fruition by people recognizing that they would be willing to take on a task of completing a workbook that qualifies them to be a member of the incident management team, which can take up to 2 to 3 years depending on the position they're trying to qualify in. An incident management team has 8 personnel assigned it, with a command staff and an operations staff, finance staff, and logistics staff, all to help manage bringing all resources together to effectively address the disaster. Now, while the Governor talked a lot about the Hubbard fire, and I'm talking about the 2012 fire, this team can also respond to all other hazards. It's designed to do that, to bring in a layer of coordination and support to local response to make it effective. So it's a definitely a great moment for us in the state of Nebraska. And ultimately, at the end of the day, as as the State Fire Marshal reminded us earlier today, this is about Nebraskans helping Nebraskans, and that's what makes it even more important, I think. This all started in some ways because then State Senator Al Davis brought forward legislation in 2013 to create the capacity for us to contract for the single-engine aerial tankers, and also legislation that gave us the ability to join the Great Plains Fire Compact. That compact allows us to share resources with surrounding states, and in fact, in the Hubbard fire scene, there were ultimately 4 single-engine aerial tankers that were brought to bear on that fight. A DC-10 retardant, a large airplane, brought out of Colorado as part of that contract, and then we added 2 UH-60 Black Hawk helicopters to the fight. All that coming together in coordination with the local response, which ultimately was managed locally. We didn't have an incident management team there. But that enabled us as a state to contain that fire and keep it at 4,000 acres, or a little less than 4,000, rather than growing to 10,000, as the governor said. What we did do in that fire response, though, was we have the ability to scale up to the Type 3 incident management team. So we essentially used an incident management assistant team with members of John Erickson's team from the Forest Service, members of the WIRAT, which is a Wildfire Incident Response Assistance Team from the State Fire Marshal's Office, which takes the lead, but Forest Service is involved. And then we also sent operational folks out from the Nebraska Emergency Management Agency, all in support of the local incident commander. Worked well. It's worked exactly how it should. But because of that vision by Senator Davis and what we've grown into our training capacities, interagency work, and local to state, that continuum as well has made us what's so effective. And so it's a great moment for Nebraska. It's great to be in this position to know we have that resource and ability to respond to any incident in that manner if needed, and keep control at the local or state level whenever possible. So, Governor, I think that's all I have for today. Thank you.
Great, thank you, General. And actually, one of the things, I'll just piggyback on that. Obviously, as you mentioned, this was actually managed locally. So Tim Grubbs was with Banner County Fire, actually managed it with the help of Tim Newman, who's the emergency manager, and Nate Flowers, who's in the Gearing Fire Department. Right. But you said the training that you all had done since 2012 really helped make sure that the local folks were prepared to be able to manage this incident. So that's another improvement that I think we made as part of this as well. Yeah, so the additional training for local folks. So really beefing up of all the capacity for everybody up and down the chain here to be able to make sure we manage this well.
Yes, sir. And in fact, training's going on this week.
And training's going on this week, right. That was scheduled just coincidentally to follow this. All right, very good. Thank you very much, General. So also, as we get past the Labor Day holiday here, we know that the school year has started, and it started very successfully. Schools have made adaptations for the pandemic to be able to help manage it. They've been working on spreading students out, wearing masks, making all sorts of other accommodations to be able to successfully open those schools. And here to talk to us a little bit more about that is Commissioner of the Department of Education, Matt Bloomstead, to be able to talk about how that school year has gone with regard to opening that up. Commissioner?
Yes, and thank you, Governor. The reality, I think, for us is, or at least for me, I'm very pleased to see that the school year is several weeks in, actually, now. And so far, and I should knock on wood when I say such things, but so far, we've seen very few cases that have been spread in schools. And I'm going to credit the folks that have done the hard work on the processes that have been built in schools, the approaches that have been used. The work with all of the different partners. So thanks to teachers, thanks to custodians and maintenance staff, thanks to superintendents and principals, thanks to school boards, thanks to everyone who's done that work. And also thank you to all of our local health departments, our state health officials as well, in really building a very comprehensive set of plans across all of our schools. Not every plan looks exactly the same, but I think that's also been the unique nature of this. Understanding what the threat is part of our responsibility, and building building those plans appropriately so every school has their plan and they know what they do. Now, we've certainly seen a few cases of positive cases end up in schools, and there's a protocol and a process that was agreed to, that was set into place. And by following those protocols, we believe we can continue to have a successful school year, being very thoughtful about the needs to be able to do this and do this work. And I do appreciate that working with Gary Antone and others at DHHS, coming up with the importance of setting out some flexibilities for our schools in quarantine and isolation procedures as it relates to teachers. We actually saw a DHM change last week that I think is important to allow local health officials some flexibility in what that may look like, but ultimately understanding that it's about maintaining safety of the students in the student environment and the schools and the settings that we're at to make that consistent. There's a lot of bravery that's going to have to take place in this school year. I think there's a lot of different things. Last week I heard of a football team on the way to a game and actually had to pull that team back based on a positive case. There are decisions that have to be made, and you do that and you act decisively, and that actually fills into our foundational values and our expectation for our schools as they're working. Continually thinking about the equity and the equity of the environments for our students and the thoughtfulness of that. Thinking about quality. We don't want to give up on a real focus on the educational quality and the opportunities that are present, and continuing to manage that with the health concerns in mind as well. We continue to provide flexibilities for schools, for example, anyway, local subs that are necessary right now. If we have teachers that are quarantined, there may be sub procedures that have to be in place. And so we've outlined a whole set of flexibilities for schools to understand how they can use local subs, and we've tried to expedite those processes so they have subs in place when they need them. And then also allowing teachers to be able to, if they are quarantined, to be able to teach remotely, possibly from home in these cases, and be able to work flexibly with other either paras or substitutes that might be in the classroom at the same point in time. So we've provided a lot of those types of flexibilities. Obviously, safety remains the primary point of focus of all of the different plans, as the governor's talked about, the importance of masking, the importance of social distancing in schools, the importance of understanding and parents understanding that if a student is showing any signs or symptoms of being sick, that they stay home. But that goes for employees of the school as well. So everyone being really cognizant of those things is important. And then ultimately, like I said, being decisive. If we have a case that is a concern, that we know what the protocols are and be able to move quickly into the environment to keep everyone as safe as possible. And it's really important that as we've built these plans, that there's always this chance that if that plan's not working, to come back and revisit. And we've really kind of worked with school leaders across the state to make sure that they are always constantly reviewing that data. I think we have good examples of schools using data to understand what the risk is in the school, and if they see something that's a problem, that they should go ahead and come back and revise those plans. I've been very pleased with the local health departments and the work that we have. It's not always easy, and sometimes it's tense between school officials and local health department officials because they're trying to do the right thing, and everyone wants to be able to do that and do that effectively. But I think very much like the incident command that we just heard about, this is a new set of structures for the state of Nebraska to keep our students in our schools safe environments. Ultimately, as we look at return to school and the protocols that we laid out, we continue to evaluate that. I would say at this point in time, we want to stay the course. I sometimes hear from certain areas of the state, oh, well, it's going really well. Can we loosen up restrictions? No, this is not the time to be doing that. In fact, we're going to have to maintain those restrictions throughout this period of time, understanding that the pandemic's still in place, as the governor has mentioned, and continue to really be vigilant in our efforts to make sure those environments are working well. I think it's also important that folks understand that there's definitions of close contact that are being used in our school settings. Part of that close contact includes if students are within 6 feet without masks, that's going to be treated as a close contact, and folks are going to be asked to quarantine if there's a positive case. It's important that parents and teachers and students themselves understand those are the protocols that are in place. It's also important to understand that quarantine is part of the process to help keep the environment safe. And so sometimes I think we've felt like there might be some pushback from folks, well, I don't want to have to go into quarantine. I wasn't really that close. That's, our hope is to be able to continue to work on that and make sure that people understand that. And then isolation, which I think sometimes gets thrown in with quarantine. Isolation is when someone actually is sick, right? That they've understood that they've either tested positive or have all of the symptoms that are in place. And those are distinctions that I think are really important. And we're having to, kind of train not just parents and teachers, but even students themselves to understand these new terms as we go forward. Now, I'd like to end really on educational opportunities. And so often during the summers, our schools are spending time to ensure that we're improving practices in education itself. This summer, I'm just going to be frank that we've spent a lot of time on health. And now it's really an opportunity to go, how do we move forward with improving remote learning, continuing to learn from the environments that are working? And we've really launched and started to talk about the importance of making sure that our students are connected and that they're present, that they're engaged, and that they're supported. And as we work with schools, we want to make sure that students, regardless of their circumstances and where they may be receiving educational opportunities, have that chance to do that. And I would also just end on this, that we have a whole school year yet to get through, and we're still learning. I encourage that everyone remains flexible in understanding the environment. It's about keeping everyone safe. Not to get frustrated, we're early in the process. I think one of the great things in Nebraska, and I've looked across the country, I suspect we have as many students as a total percentage of our student population as anyone does across the country actually in schools. I think it's a really proud moment for us to be able to look at how we've really supported students and schools to make decisions at that level. And as we continue on, it's going to be important that we maintain this safe environment, and again, stay vigilant in our efforts to make sure that the safe protocols and procedures are in place. So with that, I'll end, and thank you, Governor, again for the opportunity to be with you. And I don't know, it's not 2 weeks in a row for me, so I don't know if I get that extra award. All right, yeah.
Sorry, Commissioner, you're here all the time. Hey, John, there's some noise coming from that room. Could you close the door, please? Thanks. Commissioner, I think we were talking about this before, there's an analogy here with regard to our long-term care facilities, which we got to continue to protect as well and take different steps for with regard to schools. Is the same sort of deal. So thank you very much for being here to give us that update on the school opening. With that, I'd like to, Justin, I'm going to check with you to see if anybody's sent in questions ahead of time.
From WOWT. So the first of those questions, 6 Greek houses have been suspended on UNL's campus after pictures and video surfaced of large gatherings with no social distancing or masks. Would you consider closing down bars in Lincoln or other college towns similarly to what's been done in Iowa?
So WOWT asks with the 6 houses, Greek houses that were suspended here on, what was the exact term you used there, Justin?
They were suspended on UNL's campus.
Suspended on UNL's campus for large gatherings without social distancing and masks and so forth. And then the question was, will I consider closing down the bars as has been done in other states? And the answer is no, we're not really looking at that right now. Wouldn't say we might not do it in the future. But at this point, again, what we're really looking at is hospitalizations. And while, if you look here in Lincoln, our hospital cases are up about 35 cases. Is that right, Dr. Antone? That's relative to the overall hospital capacity here in Lincoln. That's really not very much. So that's really kind of our guidepost, is looking at the hospitalization capacity. So you never say never, but at this point, we're not looking at any considerations like that.
And the second question also comes in from WOWT. Where do you stand on extending emergency SNAP benefits? Will you extend them?
So the question was with regard to, there's a variety of emergency SNAP benefits. So there's a variety of different programs there. One of the programs we have chosen not to extend, that was the maximum payment allowance under the SNAP program. And the thought process behind that is 40% of the folks who are on that program already receive the maximum benefit, and it's based on income. So if you are a lower income person, then you get obviously the maximum benefit. If you're a higher income, you don't get the maximum benefit. So we're going back to the program as it existed before the pandemic, which would be that program. And again, the emergency maximum benefit that everybody received was really meant to be a pandemic type response. So as we went through the peak of the pandemic and through the end of July, that's when through that program, that's when that was really necessary and enforced. And now we're getting back to a more normal life. Unemployment has fallen below 5%. People are returning back to work and that sort of thing. So we think it's appropriate to start going back to a more normal benefit with that. Now, there are other things like the emergency PBET or whatever thing that we are going to be looking at extending as well, as was the WIC programs. So there's other things we are going to be extending, but this is not one of them.
And then a final question from WOWT. What are your thoughts on the Nebraska Supreme Court making determinations on medical marijuana, that ballot measure, as well as ruling on expanded gambling? What are your thoughts?
So WOWT is asking what are my thoughts on the Nebraska Supreme Court ruling on the gambling and the marijuana ballot initiative, and that is certainly up to the Supreme Court to make those decisions. All right. Other questions from the audience? Yeah.
So my question is just your plans for this weekend as it pertains to Investigator Herrera's funeral service on Saturday.
Yeah, I'm planning on attending Investigator Herrera's funeral, and I've been asked to speak at the funeral as well. Be at 10 a.m. on Saturday is my understanding. Martha?
Governor, the Test Nebraska had a glitch over the weekend, and so can you explain what happened and how this affected the results that people were getting? And also, if this is related to Test Nebraska closing down the test sites over the weekend in Omaha?
Sure. So the question from Martha was with regard to, we had another technical problem with regard to Test Nebraska as far as test results not getting out. They got snagged on Friday afternoon, evening, and did not get pushed out until Tuesday. It was not related to us closing down the test sites. We just decided to give people who are working the Test Nebraska test sites the Labor Day holiday weekend to enjoy with their families because they've been working so hard through this pandemic. So it was not related to that, but it was technical issues, again, related with regard to our vendor and their systems talking together. And Dr. Antone, I'll ask you to come up and do you have any additional comments to make beyond that? Because we did get about 7,000 tests or more pushed out yesterday on that.
Yes, as the governor said, over the weekend, some of the test sites were shut down. The lab was not shut down, so the lab was continuously working over the weekend and on Labor Day. Or excuse me, I think on Labor Day, the lab was shut down. And so we noticed that there were a lack of results coming in over the weekend, and then we found out there was more of an electronic reporting error that we discovered late Friday, and then was not able to be fixed until yesterday or late Monday. And then we had very few test results come in over the weekend. And as the governor mentioned, we had close to 7,000, 7,500 test results in yesterday. So we're all caught up now. The lab is all caught up as far as doing their testing and as far as the reports are out. So it's more of an electronic reporting error than it was an actual lab or testing or test site error.
What about people who were waiting on test results?
Yes, there was like a 3 or 4 day lag there. So now they all have their test results. All the public health departments have those test results.
But they had to wait.
They did have to wait 3 or 4 days, yes. Whereas the average turnaround time over the whole time of Test Nebraska has been right around 2.5 days. Over the last 14 days, averaged around 3 days.
Thank you, Dr. Antone. Fred?
On the all-hazard teams, how is this different other than bureaucratically from what has been done in the past? I mean, it seems like you got a problem, you call the state, it's beyond the local capabilities, the appropriate state agency gets involved, and if they think it relates to somebody else, they talk to that other person. So is this just a put all the people in the same room kind of deal?
Actually, so the question was, how is this different from what's been happening in the past? And General Bohack, I'm going to ask you to come up and explain, but essentially you had the local people, or if it got too much, then we'd have to kind of skip over and get the federal people involved. This actually gives the state a way to kind of manage that incident directly, where we don't have to skip that step. But General, I'm going to let you kind of get into more details about this.
I think what's fundamentally different about having an identified incident management team is the fact that you've got each player and each specialty already identified and ready to come together on a moment's notice. So folks, when they when they agree to go through the training to become a member of the incident management team, they're really signing up for that kind of response mechanism. Prior to that, I would say we were more of a pickup game, and instead of bringing a team in, we would bring 1 or 2 people depending on the needs presenting to us. So I see this as a way to be more effective with local resources and to help manage and to be actually to respond faster than we might have otherwise.
So if it's a flood, for example, under the old system, you would have had maybe the National Guard called, but now the fire marshal's gonna be there too?
So the fire marshal would be there depending on the needs presented in their membership on the incident management team. Remember, when we have a large-scale disaster in Nebraska, which the governor has made a declaration, and actually the governor has to make a declaration to put the incident management team into play. We have emergency support functions that come to our headquarters at Nebraska Emergency Management Agency. One of those emergency support functions is represented by the fire marshal's office as well, just like Nebraska Department of Transportation, Nebraska State Patrol, all coming together to identify what the best resources are to respond to the particular hazard or emergency we're facing.
But General, I think the difference is in the past, we've always been a support to the local folks who have still managed the incident.
Yes.
What this is different is now we, the state, can take over that actual management of the incident directly in place of the local folks, if they ask us to do that.
Yeah, and that's what the governor just said, that last sentence is, if they ask us. In other words, we're not gonna show up and try to take over. What we're gonna do is respond when asked to respond. When the locals make their own assessment to say, this is larger than what we can do alone.
And it hasn't been the state in the past, I mean, it hasn't been NEMA, it's gone directly from the locals.
We've had individuals from NEMA go out, in the YRAT team, the Wildland Incident Response Advisory Team has been in play for some time now, but it's not been a coordinated effort necessarily. And that's what this brings
What's
up.
also important in the past, it's always been the local people who have managed it, unless
That's
it gets
correct.
way too big, and then
Then we go to the federal
then we go to
response.
the
Yes,
federal
sir.
response, yeah.
Yep.
Yeah, Andrew.
Governor, on the SNAP benefits, I know you have some indicators saying that the unemployment has kind of gone back to normal, so going back to normal, but it sounds like there's still kind of a lag time, there's still a heavy demand for food, emergencies. I mean, how do you address that? I mean, what if there is this lag that still has this high demand, the food banks are saying they're seeing a lot of people come in and they need emergency food help?
Right, so the question was, what about the demand that's out there right now? So, again, I want to take a step back. The regular SNAP program is a program that is based on income. So if you are a lower income person, then you're going to be you're more likely to be eligible for the maximum benefit. And 40% of the people on the program today are eligible for that maximum benefit. With regard to the food banks, there's still the program that's going on from the federal government to provide food banks additional resources to be able to distribute food through the food bank. So that program is still in place. We still have the unemployment insurance program, which is still in place. We last week announced the $300 from the federal government in addition on top to the regular unemployment benefits. And then, of course, the federal government right now is in negotiations to see if that will be extended even further. So there's a lot of other different resources out there with regard to this, and some of the programs I mentioned about with regard to the emergency EBT or the WIC program, we are extending those as well. So there's a variety of different programs out there that are being extended. This is just one of them that's not, because it's income-based. So if you're lower income, you'll be eligible for the higher benefits. But if you're at the higher income levels, we're going to, again, go back to the more normal program we have for SNAP. Yeah, Martha.
Governor, for the state employees, the annual giving campaign is being directed at 3 priorities, one of which is food, because with the rationale given that that's an unmet need. So you're asking state employees to donate to help feed people, but you're not willing to take federal help to help feed people.
So the question was, with regard to our state campaign to be able to support nonprofits, We are directing it toward the pandemic, and part of the subheading under the pandemic is for food assistance. So why wouldn't you just continue to do the program? And again, this is part of, again, you're making the point exactly, Martha, that we have other resources out there, and that we want to get people used to the idea of, hey, we're going back to a more normal life, right? Unemployment rate's coming down. We've got the second lowest unemployment rate in the country. Our state through the first quarter was the least impacted economically state in the country. So we are getting back to a more normal, and what you want to do, in fact, we had this conversation with Brian Barks, who's the CEO of the, Heartland Food Bank, that he was concerned about like the cliff effect when all these benefits go away. So really, what you want to do is try and start stepping things down, and this is part of that, again, we're getting back to a more normal life, and there's still resources out there available through other channels to be able to help people out. Yeah.
Why not take advantage of that federal money while it's out there?
Again, we are taking advantage of other federal programs with regard to that I mentioned already, and this is one that we're just, again, the system works well. We've already got a good system in place, right, for SNAP benefits. It's based on income. So if you're lower income, you're going to get more benefits. So that's the 40% of the people who are already receiving the maximum benefits. So we've got a good system that worked well before the pandemic, and we're going back to that system as things get back to normal. It was going to happen at some point.
Question for Commissioner Bloomstead.
Yeah, Commissioner?
You said that some districts are saying, hey, things seem to be going well. Can we loosen things up? And you say, no, stay the course, not time to loosen restrictions. How is that compatible with loosening the DHM so that teachers don't have to quarantine if they've been exposed?
Yeah, well, I think, so the question, I guess, from Fred was about how's it compatible to make the case that stay the course while loosening other restrictions around quarantine. One of the challenges is actually that the current restrictions around quarantine are actually putting some schools in a situation where they may have a harder time to maintain their teacher workforce or other workforce. And so we're really trying to balance that. I think as the governor had noted around nursing homes and otherwise, it's really important that you have that critical workforce in place. And so the issue is stay the course, because I think if we maintain masking and social distancing, we're going to have less quarantining. We'll be able to maintain that. If you start to loosen that up, you're suddenly going to have an influx of potential cases and exposures that would actually diminish our ability to stay the course, both in maintaining an open environment and moving forward as a state.
So it's stay the course with respect to masks.
Yeah. Yeah, stay the course with respect to masks and with respect to the safety procedures that we have in place and protocols there, so.
Andrew.
Matt, while you're still up there,
Sure.
I guess some would say, would question whether you're kind of shifting the guidelines just to be able to stay open, so that you have enough teachers to stay open. How would you respond to that?
So the question was, it seems like we're shifting the guidelines just to try to maintain and be able to stay open. And I think what we're actually examining is what really works in other sectors of this. We know that we have to keep nursing homes open, and we believe that it's really important that we're able to keep schools open. Now, we don't want people taking extraordinary risks. So the intention with this is that folks are taking extra precautions as a result of that. And again, having individual conversations with people to understand the level of risk. Some folks are getting quarantined because they might have been in a room with someone, versus some folks might get quarantined because they have a spouse or a family member that was it. We need to have local public health really evaluate that risk, do the contact tracing, understand that level of risk, and make those assessments. But when you treat them kind of all the same, that a quarantine is the same if you're in a room with someone versus when you've had longer term exposure, I think those are the kind of the nuances that we're trying to work out to make sure that we can keep a solid approach going forward.
But when did the time period become, I guess whether you're talking to somebody without a mask and it was only for a short period of time, what determines what that time is, I guess?
So local public health, and I think with state public health, have talked about the dynamic of 15-minute contact within 6 feet for a period of time. So I think that's been part of the conversation really since the beginning of the pandemic, understanding that's a close, and that's CDC. Thank you, Governor. Yeah, that's CDC as well.
We had another question come in.
Is this for the commissioner?
Incident management team. No,
Okay.
this will be for Manager Rohack. And the question comes to us from KM
So from KNTV, the question is, what would be the response time of an incident management team from the time of notification to arrival with the locals? It's probably 8 to 12 hours, depending on notice. Now, what we're doing in emergency management, and depending on the incident we're facing, if it's a fire, state fire marshals, Nebraska Forest Service, we're already in contact with the locals and talking to them about their needs and how they see things developing. And so this is not, I think the other thing that's really important to remember here is this gives locals great confidence that they have another ability in the state to rely upon. There were 25 local volunteer fire departments responding to the Hubbard fire gap. So think about local incident commander's ability to manage 25 different departments responding to that, having this other layer in there if needed, and if they feel it's appropriate, to bring us in. So we can get there relatively quickly in response.
Thank you, General. Andrew?
And Governor, I hate to bring up the Big Ten thing again, but I mean, what would the state be willing to offer, the football program in order, to maybe either in testing or anything else that might be able to help satisfy some of the concerns that maybe the Big Ten has about reopening football?
So Andrew's question was, what could the state do to help satisfy some of the concerns of the Big Ten to be able to allow them to give us more flexibility with regard to football games this fall? And it's conversations we've had with the university, as I said, even before the Big Ten made their decision, and even before they announced their schedule, before they then canceled their schedule. We were in talks with the University of Nebraska and the local public health folks with regard to putting together plans on how we would manage this. What could the state do? For example, some of the things like offering testing, as you mentioned. So we're still willing to work with the university and the Lincoln Lancaster Public Health Department on putting together a plan to be able to manage that should the Big Ten allow us to give us the flexibility to have those games. And that's certainly what we're pushing for. I support the university 100% when they're asking for that flexibility to have football games here. Not every state has been impacted the same. We certainly understand there may be other states that have different circumstances that may not be able to do that, but we think here in Nebraska that we can manage this and do it successfully. So that's really what I think the university is asking for, that sort of flexibility. And, again, I think I brought up last time too, just think of some of the other sports that have been canceled as well, like cross country. I mentioned this last time. Cross country is not known as a big spectator sport, right? And the whole point is to run away from other people, so it's not like you're, doing a lot of things that are in close contact. So I think that the Big Ten ought to consider the kind of flexibility for not only football, but for other sports too, to see how these things can be pulled off successfully, and give the schools each the opportunity to be able to manage that with whatever's right for their specific circumstances.
How much do you worry this has become a political issue?
The question was, how much do I worry this has become a political issue? I can't impact whether or not it's become a political issue, but what I can do is support the university and their requests to be able to get the flexibility to be able to provide some of these sports. And frankly, one of the things that I think Coach Frost said is that, look, if we have these athletes in these programs, they're actually probably going to be able to be taken care of better than if they were not in these programs, because you'll be, managing them, and they'll have something to be able to make sure they're being careful with regard to, getting exposed to the virus. So I do think there's a lot of wisdom in that, and that's one of the things I think the Big Ten ought to consider. Martha.
What are your thoughts about your fellow governor in South Dakota allowed the Sturgis motorcycle rally to go forward, and that has spread coronavirus around the nation and has definitely impacted Nebraska? Do you wish that she had not allowed that or set some different requirements for that?
So the question was, the governor of South Dakota allowed the Sturgis motorcycle rally to go forward, and there were some cases of coronavirus that came out of that. The last I read about that, actually, Martha, was you had about 460,000 people attend there, and there was about 100 cases that came out of it. That's below the background incident. You're shaking your head. Is there I'll admit the last time I read about this was over a week ago, but how many cases came out of that?
I don't know that the final number has been set, but the last I heard was closer to 250
Right, so I haven't seen any of those cases, but just say it's 250 cases, that's still probably below the background number of cases we're seeing in the United States. So, again, I haven't seen the study, but like I said, the last time I saw it was about 100 cases, maybe it's up to 250 cases. But at least at 100 cases, I know that was below the background of what is the actual spread of the virus in the United States. All right, any other questions? All right, seeing none. Again, I want to thank our guests today, General Bohack, John Erickson from the Nebraska Forest Service, Chris Cantrell, State Fire Marshal, and of course, Commissioner of Education Matt Bloomstead. Thank you very much for being here to talk about the important things that are going on here in our state. And I want to thank everybody for all the work that you're doing to slow the spread of the virus. Again, remember to keep that 6 foot of distance between you and other people when you're out in public. Wear masks when you go to the store, wash your hands. Those are all great ways to be able to help slow the spread of the virus here in our state. And our next press briefing will be on Monday, September 14th, and so we will see you all then. Thank you very much. And thank you, Francis.